You are all welcome back to my YouTube channel. So for as many that are just joining for the first time, my name is Student Nurse Mercy, and today we are going to be talking about something really important in the nursing field, which is communication. I as a student nurse have seen how effective communication helps to foster a good relationship between the staff and the patient. If you are here and would like to know why it is very important for you to maintain a good relationship with your patient, then make sure you watch this video to the end. So what is this communication? Let's put it this way, that communication is the process by which nurses exchange information with the families, patients and other medical professionals in the hospital. The communication could be either verbal or non-verbal. Verbal in the sense that they can ask their patient to take their medication and all that. Then the non-verbal aspect of it is either nodding their head to agree to what a patient is saying or maintaining eye contact with their patient. Effective communication is not just about talking and listening. It is about understanding, building trust between the staff and the patient. It is about talking to your patient in the way him or her would understand and making sure that your patient feel heard and respected. It's not the one that most nurses will just decide to be rude to their patients. No, that is not the proper way of communicating in the hospital. So this communication we are talking about is just you making sure that you build trust, you build this respect between you and your. So why is communication important in nursing? Communication is important because it helps to give the patient understanding about their diagnosis, their medication, and other things in the hospital. Now, whenever there is ineffective communication, the patient may not even understand how to take his or her medication. And if the nurse is the type that is very rude, the patient may not easily be able to speak to him or her that this is what I need. This is the question I want to ask. Why? Because there is lack of proper communication. So when there is an effective communication, it will make all those errors in the hospital to be prevented. Communication also helps the nurses to work together as a team by sharing information, coordinating care, and providing comprehensive care and attention to their patients, thereby making sure that all the patient's needs and wants are provided. What are the barriers of communication in nursing? Communication can really be challenging, especially when there are barriers. Now, there could be language barriers, cultural barriers. All those things can contribute to why it is very difficult for nurses to communicate effectively to their patients. Talk about the tips for effective communication. One of the tips is active listening. You make sure that as a nurse or a student nurse, whenever your patient asks you question, you try as much as possible to clarify it. Do not use all those medical grammars to fill the patient's head. The patient may not be able to understand what you are saying, but make sure that anything you are explaining to the patient is in a simple language. Communication is the heart of nursing practice. It helps them to build respect, trust, and mutual understanding between them and the patient. It also enables them to be able to provide the needs of their patients whenever it is needed. Staying with me to the end. If this video was educative and useful to you, I would like you to like, comment, and subscribe to my YouTube channel as I'm still growing and it will go a long way for me. Thank you once again and have a blissful day ahead.